Okay. Hi, everybody. My name is Dr. Dave Fawcett. I'm Vice President of Clinical Programming here at Seeking Integrity. And my specialty, what I bring to this team is basically a long history of work with what we call chemsex, which is the fused or paired use of drugs and sex, like methamphetamine and sex or cocaine and sex. And I just wanted to shameless plug, show my book, Less Men and Meth, The Gay Man's Guide to Sex and Recovery. So that's that.
Well, before you leave that topic, it was interesting when we were together how many people came up and talked about how important that book was, for them clinically and some personally. So I want to honor what you're saying.
Thank you very much. Yeah, that's been consistent feedback. The book's been out 3 years and it's still going strong. So I'm happy about that. Actually, the topic tonight that I wanted to think about and talk about something that kind of came up when we were there at Tammy, and that's in just conversations with people, it's been kind of in the air for me lately, and that's just this distinction between being sober and being in recovery. And we talked about some other things, and so I just wanted to kind of talk about my view on that distinction and what that all means from my perspective. So when I say sober in the context of treatment and program and recovery, my universe, I think of people who, I think of this guy, and I've mentioned it before, that in one of my groups that I attend regularly, he's been sober for over 20 years, but he is the angriest man I think I've ever seen. And he comes to meetings, so he's doing that. He comes somewhat regularly, but he's never obviously done any of the work that goes with that. So I guess that's the essence of this definition of sobriety, or sober, that he's not using alcohol, but he's really not in recovery. He's kind of stuck in that place, or what we would call like a dry drunk or white knuckle kind of place. So he's really trying to not use drugs or act out without any kind of mutual help program, without therapy, without medication, without treatment, without support. And so, as I say, we call that white knuckling or dry drunk. And basically what's going on, I think, in these cases, that he's really avoiding and not treating the underlying issues that every addict has, and then that for most of us is some kind of trauma, whether it's unfortunately sexual abuse or physical abuse or emotional abuse or neglect or other kinds of things that happen to us that really sets the stage for addiction in later life. But that has to be worked on, grief, anxiety, depression, life situations. I've worked with so many gay men who were struggling to come out as gay men, and so they were killing themselves with alcohol and drugs to kind of smother those feelings, and those really need to be addressed. In those cases, the alcohol and drugs are really functioning to serve a purpose, to keep those feelings buried. So if I take those feelings, are going to come up, and if I don't give that person some support to deal with those feelings, it's going to be that much worse. And the other thing about just being sober, this kind of dry drunk, is that it's much likelier that they'll switch addictions. So somebody may get clean from alcohol and start spending money on their credit cards or gambling or eating or act out sexually, or, it's very easy to kind of just play whack-a-mole with these different behaviors. So that's one side. The other side, I think, is the recovery side, right? And that's where I would say clearly the disease of addiction, it's in remission. It's not cured. Recovery is not a cure, but obviously it's kind of goes dormant for a while, but it can easily be reawakened. But there's some characteristics. One is that I think people in recovery, as opposed to just kind of white knuckle sobriety, sober, are really free for the most part of cravings. They're free for the most part of the mental obsession that can really grip people. And I think it's sort of a lot of the anger of people that are kind of doing these white knuckle sobriety things without working on themselves, that the anger comes from their frustration. But these people are also people, I think, in recovery have treated those issues that I mentioned, the underlying trauma or grief or depression or anxiety, and really started to address that. They found a way to really fill that void. And I think if you go to any meetings at all or hang around addicts, they're going to talk about this big black hole that's impossible to fill right here. And so I think addicts in recovery have learned how to do that with connection, with recovery, whether it's in treatment, whether it's the support groups, whether it's sponsors, reconnecting with friends, family. It's that social connection that we're seeing is so vital to really support that recovery. They're connected whether they're through treatment groups or alumni or 12-step programs or whatever it may be. And finally, I think they've made really significant changes in their life. And I don't know any recovery recovering person who can sustain it without really making some changes. And that may be the people in our lives, the places we are, the kind of things we do. But they're, we don't recommend major changes right off the bat, but I think it's important to understand that the way I had structured my life in my addiction was not working to build a life in recovery. So that's kind of the big thing. I want to just say a few words about recovery from sex addiction and porn addiction, because it's a little different in that obviously you can't be abstinent from sex. We don't want that. That's not ideal. Just like a food addict can't be abstinent from food. So we have to learn how to incorporate a recovery plan with those ideas, how to reintegrate this potentially addictive substance back into our lives. And so we have the boundary plans that I think people are used to hearing about. Quickly review. The inner boundary are things that really basically define that I'm in relapse if I'm doing those things. And the behaviors, it's not the behavior itself. The behavior a single behavior might be found in the inner boundary for one person and the middle boundary for someone else. So that's an important distinction. But there's some typical things in that inner boundary, cruising for sex, drinking alcohol or using drugs, in my mind is problematic for a lot of sex addicts. Paying for sex, flirting with anybody other than your spouse, those kind of behaviors of not being in recovery. Then the middle plan is that slope area that we talk about that might be overworking, getting worn out, going online when you're alone, arguing with your spouse, skipping your support group, starting to thin out on meetings, poor self-care. You get the idea. Excessive worry. It's kind of those things that can really put us off balance in our lives. And then the outer boundary are things that really affirm us and help us. So it may be something getting a medical checkup, or taking care of ourselves, getting daily journaling, meditation, getting adequate sleep, going to school to finish a degree that we maybe abandoned along the way. So those are the kind of things that I think are important to define recovery and versus sobriety. And it's quite clear cut with drugs, not as so with sex addiction, but we still have a very clear plan to handle that. So just to wrap up here, a couple examples we've seen lately. I often see a meth user, for example, who uses meth but feels he can drink alcohol because alcohol was never the drug that kind of brought him down. And so the danger with that is that alcohol disinhibits. People use it to disinhibit for sex, but it can also disinhibit one's resistance to using meth. And I've had clients who have gone out for a drink with friends in a beer, Friday after work, hang out with their friends, and suddenly they're out using methamphetamine, and because they just lost that resistance because of the alcohol. A chemsex who uses poppers. We've talked about this before too, the poppers being the butyl nitrates that people inhale it's a real mood altering drug that affects, it enhances sexual sensations sometimes, but people really, I think, who claim to be sober are using poppers, and I think that's problematic because it is a mood altering substance that's clearly paired with their sexual behavior. A sex addict who claims to be in recovery, but vividly fantasizes about women he sees on the street. That's getting up into that addictive space as well. And then finally, just want to talk about our program and the fact that we're non-smoking. And I think this is carrying that same thought to its logical conclusion. And our belief is based on science and neurology. And that simply is that nicotine is a really powerful drug. And nicotine actually works in the very sort of limbic, that inner reptilian part of the brain, and it primes the brain for addiction and teaches us how to be addicted. So, and it really is that gateway drug. If young kids are learning how to smoke, they're basically teaching their brain how to become addicted. And if we have someone come to treatment and they're paying us their good money and trusting their lives with us, and we don't address the nicotine, I think we're doing those people a real disservice, because they may be clean from other drugs, they may be clean from acting out behaviors, but if they're smoking cigarettes, it's like keeping that addictive engine on idle. It's all it can always be reawakened. So it's really important because the edges around sobriety and recovery kind of get fuzzy for people sometimes. So I really wanted to talk about the distinction on all the elements of recovery and some of the slippery slope areas that people can find themselves in.
So lots there, but before I chime in, I want to, so now what about my physician who has, and I'm not saying this is me, but so I'm in recovery. If my physician prescribes something for me, um, uh, I have anxiety and that's a bad example. Okay. So medical marijuana, here's one. So what about medical marijuana? I get prescribed it and now it's a medical thing and it's not just a recreational drug. So, what are your thoughts on on another substance like that? Or, there are plenty of physicians who will prescribe a drug without really understanding. And there's a lot of people that I know that are not as upfront, about their recovery process. So can use those. So any thoughts on that?
Yes, that's a great point. And I think there's responsibility on both sides of that, of the physician's desk, right? It's up to us as recovering addicts to really out ourselves, to tell our doctors, hey, look, I'm in recovery from this and this and this, and to really make it clear to the doctor. But it's also the responsibility of the provider, the practitioner, the healthcare practitioner, to really understand the power of some of these drugs. I have a former client. It's really a great joy. He was former really down and out meth addict, and he's finishing up medical school right now. And so we stay in touch. Yeah, it's really cool. But he was saying they get 3 hours of addiction treatment in the whole course of, so these doctors really don't understand a lot of the essence of addiction. And so I think it's really important. I just constantly advocate for more that, a drug like anxiety, an anti-anxiety drug, a lot of these drugs are very powerful, the benzodiazepines particularly. They should be used only short term, but they're given for long term. They're given renewals. The medical marijuana case, yeah, it can be maybe effective for some people, but is it appropriate for a recovering addict? I think not, just because it is a mood changer. And the same with pain medications, I'll get a little personal here. I'm a cancer survivor. I had non-Hodgkin's lymphoma over 20 years ago, so I'm well past it. Everything's great. But I was many years in program at that time. I had a lot of pain with that. And really, I went like 10 years or so in recovery before that without using any kind of pain medication because I was really a purist. And I was really suffering. And so my sponsor finally said, look, pain is not healthy either. There are times when you need pain medication and don't be stupid. And I succumbed and I used the pain meds, but I gave them up right away. And the other thing, and I was in the hospital, it was very ritualized settings and aftercare. And when I was getting outpatient treatment, I actually gave the sponsor my pain meds. So there's ways to deal with it. If you have to take them, it's best to kind of share the procedure and responsibility. But I think ultimately it falls to us. I mean, there's going to be a doctor that's going to say, hey, why don't you do this? Doctors like to have us walk out of their office with a piece of paper or a prescription, having been sent to our pharmacy, just because that's what patients often expect. Just like we go in for sinus stuff and we want an antibiotic, even if we may not need it. So it comes down to us and taking responsibility for that. But I think more and more as different kinds of drugs, now this whole universe of medical marijuana opens up, it's even more gray area that people have to really kind of encounter and decide that, no, I'm an addict and that's really not going to be for me. Yeah.
Yeah, thanks for sharing that. So I had sinus surgery a few years ago, twice, because the doctor was really good. He was like, I just never have seen this. And he gave, I am upfront with all my doctors, and he gave me a very low dose of something that was, non-narcotic. And I realized that my dog, who was half my weight, was on it for we had the same medication, except his was twice as strong as mine, and he got to take twice as frequently as me. And I was like, but my doctor was like, he was so proud of me, and he was like, I don't want to do anything to screw up your recovery. And it took enough of the edge off. Was it fun? No, but it was 3 days of, blah, and then you just kind of go. And I kept thinking, I used up all my ability to use all the really good stuff. I did it back in the day, and that, so that time was over. So, so it was, my pain was managed. It just wasn't managed, but yeah, I am very much like you. like you were sharing about, like for me, it needs to be recovery from all mood altering things. And, for me, I had the luxury of going to treatment. I knew alcohol was a problem. I thought I did recreational drugs. So I really had a vision of coming back out and smoking pot and, the little bit of drugs that I did or whatever, those were harmless. Not so what I learned is anything anything that I was looking for affecting my mood was a problem. And still, like to this day, so B vitamins are supposed to give you energy. Well, I'm still looking for them to do what the drugs did, where like you had energy and they don't, and so I said that to my doctor, and I swear he was looking at me like, I said, this is just how my brain thinks, so no, like now he has me on a vitamin regimen and all that kind of stuff too. But like, I was like, why take them? I don't feel any different. So why bother,
Right.
This is many years. This was just a few years ago. This is many years into recovery. That's still how my brain thinks. But the hard one was food. And, so like you were talking about with sex, sex, food, all of the processed addictions, it isn't that we can just, like I did with alcohol and drugs, you stop and there's a really clear delineation, and, that didn't happen again. And so, I'm in recovery from that. And same thing, I never say I'm recovered, I like, because I know that my addiction, like I need to keep doing what I need to do to maintain it, because otherwise it will lie dormant. I know too many people who had long-term recovery, and at least for a period of time were doing what they needed to do, and then they kind of stepped off. So I don't want to do that. But with the food addiction, it was challenging, and to learn to have a healthy relationship with food and not have it be the shame spiral of, so we went to a really nice dinner the other night, and they had a delicious piece of chocolate cake, and I enjoyed every single bite of it. And it used to be if I would eat that,
I didn't get it, by the way, but okay,
well,
I'm okay.
I planned better. Yeah. But it was fantastic. But like it didn't change my like, oh, you're a bad person because you ate that. I mean, like it used to be this whole shame spiral around, I'd done that, and and for a period of time when I was really in my addiction, there was, sneak eating and, I mean, it was chaos and craziness, but it numbed me out just like alcohol and drugs did. So I was still unable to deal with life at that moment, and, until I had tools. So what you started out with, talking about, sobriety and recovery. And it's really challenging, because if you stop the behaviors, the behaviors covered up, all the pain, you talked about dealing with, with the anxiety, the underlying trauma, whatever, which I thought, gosh, that's not really an appealing, we're not going, gosh, you're going to love recovery because you get to deal with all this stuff. It's not fun. But I was just talking to somebody too about that void. And, because there was somebody that was really kind of at a point going, well, screw it, I want to just go have sex and I don't really care. They weren't in recovery, and they hadn't known the benefits of recovery. And it's hard for somebody who hasn't had that to even imagine that I cannot have this empty space that I'm trying to fill with whatever it is I'm trying to use to fill it. And they don't understand that the high of the sex, the drugs, or whatever, it's different. So if you're in a connected relationship and you're fully present, because one of the things that I found for me, if I'm numbing out the pain, I'm also numbing out the joy, the connection. I'm numbing out everything. I am not able to connect with people on any kind of more than a superficial level. And that, in my opinion, is what gives my life true meaning. Having exciting experiences, or mind-blowing sex, or whatever, that's instant, but it's those connections that are enduring, and I think the most meaningful thing. So
absolutely.
Yeah, I want recovery, and I want it bad now, and I don't want to be substituting, one thing for another. And I do get the grieving the loss of, like we had somebody that was reaching out about using pot versus with sex. And I thought they can't even imagine without it, first of all, and understand it. But it's a process of having to grieve the loss of having, like I said, I had to go, I gave up my right to use all the good drugs. Oh, well, so.
Yep. Yep.
Yeah.
So, everybody, we're talking about the difference between sobriety and recovery, or being sober, being kind of white knuckle sober versus being in recovery fully. And so ask questions. We have a few coming in, but feel free to talk about that or anything else, really.
Yeah. And I'm going to start with the second question because I want to go, no, like, it's so good, but I'll read the question first. So this is the thing that sounds so discouraging for me. It sounds like there is never any freedom from addiction. That's not true. So we'll talk in a moment. Is there any way to figure out how to deal in a healthy way with behavioral addictions? Yes. I need to work on my recovery, but I get there feeling there is no real getting over it ever. So start and I'll chime in because obviously I'm excited about this one.
Okay, yeah. So, I can see how it can appear discouraging because it's kind of overwhelming. A lot of our thoughts and beliefs about ourselves, about the world, about how we deal with the world and interface with it are challenged with addiction because they're not working. And I think a lot of the behaviors we're talking about in terms of that inner boundary and middle boundary are things that once I got kind of over the hump, I was very glad to get rid of a lot of those things. I didn't want to walk around feeling like a victim anymore, or living in anxiety, or living in grief, or all these kind of emotional states that with addiction I would get frozen into, and the behaviors I would use to just kind of keep it going. So I think I'd really encourage you to let go of that. I know it's kind of hard, but I think Tammy, it was a wonderful idea to kind of just imagine in a kind of therapy called motivational interviewing. We talk about this kind of the miracle questions, like, what if you woke up tomorrow and all your problems were solved, and what would your life look like? And I think to kind of take that leap of faith and not just take it from our point of view, but from peers you see in meetings. But there are behaviors, and it is going to be work to change those patterns and change what we do. But I will say that the sense of work lessens, and it becomes incorporated in my daily life. I don't struggle with these things anymore. I don't think about it. It takes energy. It gives me joy. I get excited going to meetings. I get excited doing some meditation. I get excited examining my life. And I think it's this flip-flop that's happened. And so I think I would just really encourage you to be patient and give yourself the gift of just time and patience and working on it, because there absolutely is freedom from this. When we're in that rat race of addiction, whether it's like, anticipating or using, or the regret and remorse afterwards, and that cycle everybody falls into, it's really hard to imagine life outside that hurricane. But it's there. And so just patient tolerance and just easy does it. It doesn't happen overnight, but it does happen. It does happen.
And I 100% agree, because I go to 12-step meetings, and again, I go there, most of the time just to connect with people. Every now and then I go, I really need a meeting, and it's for me. I want my serenity, so I live the steps. I don't have to think now, well, I'm doing step 10. They're just so part of who I am. It's how I've learned to live, because somebody had to teach me. I didn't have those skills before, somebody had to teach me. So, are there healthy ways to deal with behavioral addictions? I'm living proof, I have a healthy relationship with food. I can't remember the last time I had, I can. So, one of my I go to a gym at a local gym, and she has these fitness challenges, and the fitness challenges had been all exercise related, and I did all those, including like 50 burpees every day for a month. That's a fitness challenge. Then she started doing the food thing. So, and she started like, take out this or watch this or whatever. And I shared with her, I said, it's a little Facebook group, and I said, I'm going to tell you where I'm at with this. I said, you're not going to see me share. And I said, because I'm a person in recovery from an eating disorder, and too much focus on the food like that gets me starting to think in those kind of patterns, and I just don't need to be there. She thanked me for sharing that, and she's like, wow, so she was very, and she shared about somebody else that, she knew that, but I owned that, like, I know that that's a rabbit hole that I don't want to go down. So I will do stuff. I will try to, I will do what I know I can do safely for me. Done. That was it. But I don't on a daily basis, think, okay, today I have to, it's, alcohol, drugs, food, eating disorder. Like, I just never think like that. But when I said, I don't take addiction for granted. I don't just go, well, I've been in recovery for this long, so I'm sure I'm fine. I don't, because I know people who have had more time than me that have relapsed. So I do things, most of it's just part of my natural life thing. But, I try to have gratitude every day for my recovery. I try to be positive, but I also try to remember all the things that I've been taught, like those things just kind of pop up, and I can insert them into my world. And that's a good reminder for me. So, but yes, you absolutely can. And the one other thing I thought of, when I go to a 12-step meeting, I can know who's been around for a while. And part of it is their countenance. And what I mean by that is, there's just this kind of a serenity that those of us who've, done the deal for a little while, you get to this different place, and stuff that, would have rocked my world, in a negative way, a longer time ago, you just kind of go, I have tools to use. I can, it's just another life thing. And I have support, that I can do that. But there's something, to like, I think there's some joy and serenity that, that is, one of the rewards of doing the thing. So, okay. So more questions. Can you clarify the difference between mood altering substances and mood stabilizers?
That's a great question. So, yeah. And this often gets confused. So mood altering substances are things that basically alter our moods, right? That can be different kinds of drugs, the anti-anxiety drugs, or obviously some recreational drugs, the stimulants. A lot of young kids are prescribed Adderall, which concerns me because kind of teaching them it may be beneficial, but I worry about all the stimulants that are being prescribed by people. So there's a lot of drugs that are mood altering that are prescription drugs. Mood stabilizers, on the other hand, are drugs that are really designed to help people level their mood. So they may be people that experience real highs, like manic highs, and real lows, and they're kind of up and down, and they have real no control. They're kind of being pulled up and down in these kind of either manic states or into kind of the depths of despair. And mood stabilizers are a very effective way of kind of leveling that. And they're not necessarily mood altering. They really work in the background, like a lot of antidepressants as well. The SSRI, especially antidepressants, you don't know you're taking it. It just kind of is kind of helping to keep the bottom from dropping out from under you. And so that's an important distinction to make. And I think one of the things we see, especially in the earlier days of 12-step programs, people would come in and there would be, I think, ill-informed sponsors who would insist that their sponsees get off everything, including antidepressants that were prescribed by a doctor. And I think that's a big, huge mistake. First of all, sponsors are not doctors, but some people need certain medications. I take medications and I have to have them. And fortunately, they're not mood altering, but they're important for me. And I think that's a discussion really between someone and their doctor and maybe their sponsor to talk about it. But I don't see that as much. Tammy, maybe you do in a different part of the country. I don't know. But I think now people tend to be more aware of the role that something like an antidepressant or mood stabilizer has in the life of someone who's in full recovery. It's part of the game. But when it gets into mood altering substances, that gets tricky, because that is really putting that person into a headspace that is just inviting them to go forward with their old habits. So yeah, it's an important distinction. Thank you.
I think so. And it's like the pain meds that you talked about too. It's like, there are certain people or certain times for many people where, intervening on things. And, like for some people, we've talked about on Dr. Rob's too, some people are clinically depressed and that's just how it is. And it could be that it's a temporary thing. And if they get some medication that helps stabilize it, they can get off that at some point. Some of them need to be on it, for the remainder of their life. And that's okay, as long as it's, it's done at the proper dosage and it's well monitored, that is just, I always think of it, it's like, if my body just doesn't have the right chemical, I'm just inserting the chemical that's going to, put things in an equilibrium again. So,
Right.
but I agree with you. And I often heard it in the 12 steps, like you said, the purist, it's like, get off everything. You can't be, you can't be sober if you have anything. I'm like, well, I'm not a physician, and you need to go see somebody who's actually qualified to figure it out. But I also do take responsibility for my recovery, because there are doctors that will just prescribe. So it is something definitely to discuss with full disclosure to anybody who's prescribing.
Right.
Okay, next, I'm a sex and porn addict. I started watching straight porn and then switched to gay porn. When I have urges about sex, I can have sex with both women and men. I feel very shameful and guilty after having sex with strangers, especially with men. Thing is, I have no emotional feeling with men, but when I look at an attractive men, my mind can't stop picturing sexual behaviors in porn. It made me really question my sexuality. I started feeling shame and going back to my addict. Is it a shame spiral, and how can I recover from it?
Okay, well, thank you. Yeah, I think this is not an unusual scenario in that we see some people with pornography, and we know we've talked before about dopamine and how it kind of people build a tolerance, and so they start to venture into other areas of pornography, and sometimes a heterosexual man may get into gay porn just because it's kind of taboo or erotic or in that sense. However, I think a good number of people that do that also do have some actual sexual orientation in that regard, or some appeal, some appeal to men and their physiques and their subject for fantasy. So I think we often see that people are using porn as a way to kind of keep some of those feelings at bay, but they kind of emerge and pop out. So that leads to a confusion sometimes too between what's the addiction and what is my sexual orientation. And it's not uncommon for people to be struggling with, am I gay? Am I straight? What am I? And by the way, in these non-binary days, I don't know that we have to do one or the other. There's a whole spectrum of things people can do, but people want to come in and be treated for what they're calling their sex addiction, but it's really their disturbing appeal of, say, same-sex attraction. And there are some people for whom that's not part of their addiction, that's just who they are. And so we can stop the addictive behavior, but stopping the addiction behavior is not necessarily going to stop or get rid of that sexual appeal of same-sex persons. So that's one thing I want to say, just that distinction between the addiction and the sexual orientation. They're not always the same. And so part of treatment in that case might be helping someone get clear on what is their primary sexual orientation, and if it's something that's disturbing to them, how can we help them get through that and accept it more. But all these behaviors you talk about, this idea of a shame spiral, and there's so much packed in here that I want to talk about also, besides the shame spiral, this idea of the separation of lust and love, right? Where we have this pure sexual sense and a pure emotional sense. And ideally, in any partner or relationship, there should be overlap, right? We should find people that we're emotionally attached to sexually appealing if they're a primary partner. And that often is the case with addicts, that they get to the point where the people they find sexually attractive in this addictive sort of way are people for whom they could have no emotional connection. And the people with that whom they're emotionally connected, they can't get any sexual arousal. Or the two become kind of separated. And so I think that also, you talk about having no emotional feeling for the men. I think when people are objectified as simply sexual objects, there's often no emotional content there. So I think that's just part of the addictive process to some extent. And the shame spiral that's woven all through this question and your experience, I think is important. And one of the things we see, and for those that don't know that term, shame spiral, is this process every addict has probably experienced, where they start to get overcome with shame. And that's often after acting out. It's when we're in the acting out phase, we're kind of, the shame is kind of numbed out and we're not aware of it. But afterwards, that's when the remorse, the shame, the regret pops up. And a shame spiral is just simply that thing where that shame kind of ignites and catches fire and just drags us down. There's like no escape out of it. It's like a vortex that we get caught up in, and it's really hard. And in treatment, at Seeking Terror, we talk about the fact that shame has no value. You know, sometimes there's a feeling you can work through and you can get a life lesson or something from it. Shame has no, it's empty calories. It's just totally consuming. It eats someone up, and there's no value to it. So I think it's really important to have ways to break out of shame and to take care of yourself and reverse those feelings. But I would, I think, maybe get some guidance about some of your behaviors with porn and sex addiction and straight and gay and sort of, I think the first step obviously is to really cut back on the behavior. And I think a lot of that stuff will sort of sort itself out afterwards. But I think if you can break that behavior of acting out with the porn, hooking up, and then feeling the shame, that all fuels itself. Because what happens, by the way, if you're in that shame spiral, the end of an acting out session, can be a session or can be days, how do we medicate all that shame? We go back to doing the addictive behavior again. So it just kind of keeps going and going and going. So the first step is to break the cycle, and then let the dust settle and see where you're at.
Yeah, so I read similar that the behavior. So what I hear is you've identified that you're a sex and porn addict, but you're still active in your acting out. And Dr. David said cut back on the behavior, and I would invite you to work really hard on stopping the behavior, because even if we've seen people that have a cycle of 30 days or 90 days or whatever. Like there's some period of time where they can go a certain period of time, and then it's like everything is like, I just can't tolerate it, boom, and so it never gets past that. And so then it starts like the whole thing all over again. And then so deal with the shame and start so I would really invite you to start making strides in, like Dr. David said, the inner circle, middle circle, outer circle, and being willing to be uncomfortable. And it's going to feel like I can't possibly tolerate it. It's just so awful. But can you tolerate it for 5 more seconds? Yeah. Okay. Can you tolerate it for another minute? And a lot of that stuff, can go away. I just read something the other day, and they talked about doing something creative. They were talking about knitting. I'm not going to do that, but like a Rubik's Cube, anything. And they said, if you do something like that for 10 minutes, like it changes like a compulsive, something like they were talking about eating snacks in the afternoon in the middle of the day, but they said doing something like that, kind of interrupts that. And I thought, well, that's an amazing trick. And I extrapolated that I could use that, in recovery too, to just refocus, me. And I was like, I personally like to do puzzles. And I thought, I think it does the same thing for me, because I have to focus on, something, and it takes my brain away. So,
we have this myth in our society about the ability to multitask. And
yeah,
human beings cannot multitask. Our brains aren't wired that way. What we do is rapid switching between tasks. But if we can take that and kind of use it to our advantage, if we're in the middle of this addictive cycle or craving or even being triggered or with cues, if we distract ourselves, if we, just what Tammy said, get involved in a way and get our mind off it, it breaks that trigger. And so, yeah, really effective thing. The other thing I just want to mention, I was rereading your question while Tammy was commenting, and I think one of the things we do, a simple technique we teach our clients is if they're looking at someone and fantasizing, kind of eroticizing, objectifying that person, we ask them to, first of all, disconnect from that, but then picture that person, not in sexual or objective terms, but picture them as, in this case, if a man, someone's son, someone's husband, someone's brother, just kind of put them in human terms. And it really kind of just try to break the spell of that instant sexualizing, objectifying of that person, but to really see them as a whole human being. And that does help as well, to kind of reframe. We teach our guys too, if they see a woman they find appealing on the street, to do the same thing. You know, she's someone's daughter, she's someone's mother, she's someone's wife, sister, she's a person. And that can help break that pattern too.
Well, and I'll tell you one more trick on that one is, and wonder what their hopes and aspirations are. You know, it's not just, okay, there's somebody's son or there's somebody's daughter, you know, like, it's like, I wonder what their hopes and aspirations are. Cause like, you start thinking about that, you know, you really start thinking, wow, you know, that person, you know, has hopes and dreams and, you know, all of those things. And it takes away the body parts, you know? So, okay. Yeah. Next one. So this person said, Tammy, I tell people that I've had my lifetime allotment of alcohol. Yep. I don't feel comfortable going to AA because of the negative limited exposure to the groups in my area. And that's true. There, you know, all the 12-step groups, you know, there's different groups, you know, there are some groups I would never want to be, you know, a home group member of, but I love my home group. I knew what a dry drunk was and knew I needed to replace my addiction with something healthy. The rules of recovery are my own, and I've decided to be sober to everything. I've seen many recovering alcoholics go from alcohol to pot. Every day I'm reminded how wonderful being conscious is, even if reality sucks sometimes. Well said.
Yeah, that's really beautiful, because we spoke before about how once you kind of move past or break free of that addictive cycle where you're in anticipating or grieving or anxious or recovering or what from a bad dry drunk or whatever, that it's the consciousness, it's the awareness, it's living with consciousness, with mindfulness, with intention, all that, the clarity that comes with that. And she's absolutely right. You can sometimes, the clarity brings a pain, because we have things in our lives that don't work out. And the recovery doesn't mean that we're free from problems or pain or loss, but boy, I would much rather go through my life fully conscious to deal with whatever comes my way than to be kind of impaired. And I think that gift of consciousness, it's true. We see things. I try to experience the world without filters. You know, I'm kind of uninterrupted. I'm out there, and so I feel the good times, I feel the bad times, but I'm feeling. And I think that was something that I didn't like to do very much before. I didn't know how to do. I didn't know how to tolerate feelings. That's another thing we do, by the way, in treatment is really help people develop skills so they can tolerate sitting with things that are uncomfortable or uncertain. And I think that was the big one for pain. I knew pain all my life, but the uncertainty, I couldn't stand not knowing something. You know, if you get it's like getting and by that I mean, you know, if I get a blood draw and it was going to take a week to get the results, you know, that just tell me the bad news, tell me the good news, but just tell me something. Living with that was really hard. So one of my major just kind of learning how to sit with not knowing and having patience. And so anyway, all that's a long way of saying to live consciously is really what it's all about. So thank you for that comment. That was great.
Yeah. Well, and I still struggle with living in the in-between, because I'm like, let's just get on with it. And I didn't tolerate good emotions any better than I tolerated bad emotions. I didn't tolerate them well. So next question. In recovery, what's a good plan for the morning? Waking up is such a trigger for me. I feel I need to read something inspirational and pray, but I have such a struggle doing that. I immediately want to watch porn and get the fix. Why is it such a struggle to do the beneficial thing? What has worked for others? I just hate mornings. It's so discouraging.
Yeah, thank you. It's a great question. I think it's a testimony to the power of some of our habits and the way we kind of program our days and pre-program ourselves. So I think I would just shake up your morning ritual big time, and get out of bed, go away. Certainly don't go to the computer. For me, what I do in the mornings, I do a consistent ritual. It's not a lot. It's 10 minutes, but I do some breathing. I do some setting intentions for the day. I make a little mini gratitude list. And I just kind of just be, just kind of see where am I? I check in with myself just by getting quiet and listening to whatever I might have. And it's a nice way. It kind of grounds me. It sets the day in motion in a healthy way for me. And the beauty of that is that, we've been traveling quite a bit lately. And like Tammy, I find myself in hotel rooms and kind of, where am I? I can't remember what city I'm in. But if I start my day every day with that ritual, it kind of doesn't matter where I'm at. I'm with me. I'm there. I'm grounded. I have all my resources, and I'm present. And so I think I would devise some morning recovery rituals for yourself that you can focus on, just like we talked about distracting yourself, like getting to a Rubik's Cube or a puzzle. If you focus on your morning ritual, I think the appeal of porn is going to be less. And then I would work with a therapist or with a sponsor or with people on what are you telling yourself? What are the beliefs going on there? What are you telling about yourself about the day? Are you dreading the day? Are you dreading contact with someone? Is that, what's going on there? Are you telling yourself that you don't have the skills to handle it, or that are you anticipating something? So that's where mindfulness, I think, is really helpful, because mindfulness is really just being in the present, and it sounds, well, I think most addicts, I'm not even sure about you, but I'll speak for myself. I think I still have the tendency to spend a lot of time worrying about the future, or regretting the past, but what I do try to do is just stay in the present moment. And right now I'm fine. Right now I have a good internet connection. Right now I have a glass of water, and I have my dogs, and everything's great. So yeah, so I would just really look at your rituals, get some help, but also do some reflection on what are some of those underlying thoughts. What's that I'd be curious, what's the self-talk? What are you saying to yourself, and change it. But it's going to take some actively constructing some new rituals, but I would then practice them and practice them and practice them.
And I would invite you to start the night before, because I don't know, but I suspect you're going to bed going, I hate mornings. And so, even inviting some visioning of tomorrow morning, here's what I'm going to do. That's going to be a positive thing, and being mindful at night. So you're even prepping the morning, the night before, and putting some positive in it. Because that was the thing I thought about. I thought, I bet you go to bed, just not even wanting to go there, because you're going to have to deal with the morning. So even changing the thing at night can be a precursor to having a better experience in the morning. That's
a great comment. I think it just underscores the power of suggestion and intention. There's been some really interesting studies of like families where all the men die of heart attacks, like in their 60s or even 50s. And men grow up saying, oh, my dad died, my uncle died, I'm going to die too. And they do. There's this great power of suggestion where we kind of wire ourselves, and the expectation, we have great power with our minds. And I think we can it's not magic, but we set things up to happen. So I think if we tell ourselves, it's a beautiful suggestion, Tammy, to yeah, tomorrow's going to be a fabulous day.
Yeah, I'm gonna make it tomorrow morning. I'm gonna make it a great morning, and almost like giving myself control over that, rather than it happening to me in a negative way. I'm choosing to, with intentionality, to have a good morning. So, yeah. And whatever that is, I would be very specific. And if I had to leave a written, not on my phone, maybe on my phone too, if I had to, but a written list, right, where the first thing I'm going to see in the morning is, today is a good day, and whatever. I'm very visual. I think I shared this before too. I got Post-it notes all over my computer screens. It's not when I'm traveling, but I like those notes and messages, and they are good reminders for me, even if I'm not struggling with that particular thing in the moment. And the other thing I do is I have people's names. Like if somebody's having a hard time or they're going through something, I have Post-it notes with people's names, because I want to be intentional about thinking about them. And I'll tell you what, if I'm thinking about them, I'm not thinking about poor me. That's really helpful for me too. So Okay, so we live in an extremely isolated area where there are no CSATs, APSATs, or SA, SLAA, SAA groups within driving distance. How can one pursue recovery without professional or 12-step intervention? Oh, we've got lots of ideas.
Well, that's challenging, clearly. If you're in an area like that where you can't have access regularly to these groups in person. However, if you have a good internet connection or even a fair internet connection, there are resources. You know, there's certainly at this site, Sexual Relationship Healing, we have multiple offerings every day, whether it's webinars or groups or there's podcasts you can play anytime or blogs you can read. So there's resources out there. There are other resources like In the Rooms, which has online 12-step meetings and other kinds of meetings. Dr. Rob does a meeting with them every week. And I may be doing one soon.
I was going to say, we're hopeful of you doing one soon.
Yeah. So there are, I think you have to kind of go toward the online resources, because what we know about about addiction more and more is that it's all about connection, right? It's that ability to connect with people, and real-time face-to-face is certainly probably the most beneficial, but the online connections, and I'll be frank, ever since I started working with Seeking Integrity, I thought, when I was a little, my expectations were fairly low for all the video conferencing and the quality and what we could actually accomplish. And I've been so impressed at the quality of the meetings we can have. And they're very meaningful. And I feel connected to the people that we speak with. And so I'd encourage you to seek out online resources where you can get that. And there are a number of therapists now who are starting to do work through teletherapy. And there's insurance is paying for it in most cases. And so you may be able to get a CSAT or some skilled professional who could assist you therapy-wise by your computer. So make sure you check out those options. I think that you'll find maybe more than you suspect are out there.
Yeah, one of our moderators, Debbie Allen, who does usually does, well, she alternates on Wednesdays for the Betrayed Partner, has multiple codependent therapy groups. So, you know, people contact her and she's doing therapy groups with them. She's got people from all over that are connected to her. She had one group and no one wanted to stop, so she started another group, and I think she's preparing to start a third one because it's really resonating with people and people can connect. And so, you know, that's therapy, and that's different than, you know, these are support groups. So, but I agree, there's a ton of online resources. And the other thing is, I had a friend of mine, and he was in an area and he started a meeting. So you can contact SA, SLAA, SAA. You can contact them and find out how to start a meeting. And his intention, his commitment was he would go and he would take the big book for that organization. I think it was an SA meeting, but don't hold me to that. And he would show up every week and he would read some readings. He would spend the entire hour there. And, you know, it was very intentional. And eventually other people started coming. And now it's a very strong group. This was a number of years ago, but you can start a meeting. You know, you are not the only one in your area. I know you're in an isolated area, but trust me, there are other people, you know, that could benefit from an in-person meeting too. So there are options to create those. And I think there's benefit, even if you're the only one sitting in the room, you are having a meeting. So it's great, obviously better to get input, but somebody's got to start it. So, that's another option as well. So, okay. So I think we've got time. Yeah, we do. We've got time for this one. So, Dr. Omar Minwala views sex addiction as two-component issue, the behavior, compulsive sexual behavior part, and the integrity disorder. Can you speak on how the difference between sobriety and recovery works in this two-part model, and how do you recover your integrity? So we can share how to recover, but I'm not familiar with, I mean, I know who he is, but I'm not familiar with his work. I don't know if you can address that one, so we can probably talk in a different way. And what are your thoughts?
I can't really speak to his model either specifically, but I do think that recovery from addiction does involve not just changing the addictive behaviors, the acting out, but then what, right? And I think that's exactly kind of what we've been speaking tonight about, is that people can be sober, they can be not engaging in their addictive behaviors, but I wouldn't necessarily call that recovery. And I think, and maybe we could swap out the word integrity for recovery. And that's, of course, we're seeking integrity.
I
That's
was
a,
going to
a
say,
part of
yeah,
a
yeah.
part of what we do. But I think recovery is living with integrity. It's following through in our word. It's being true to ourselves. It's being fair and open-minded and being consistent and just being who we are in a very integral way that was probably the opposite of the ways we behaved when we were in our addictions. So I think, yeah, there's two components. There's this behavior piece that we need to change, and I think I like to say it's not enough just to give up behaviors. I think we have to substitute new healthy behaviors, right? Just kind of what we were saying before. You don't just sit there and not use porn. You do something else. You get up and you make a gratitude list, or think about someone, make a call to someone else, or take some positive action. So I think we have to change those behaviors, and I think from that flows this integrity, the recovery piece that really follows if we're working our program. And the 12 steps, and I'm a 12-step person, really provide a guide for that. I was clueless. Nobody taught me how to live life. And so they were kind of the framework, and I got help from other people along the way, but there's a pathway there. So I think if we follow those steps or follow a recovery program, we do develop that integrity for sure.
Yeah, we are seeking integrity. I was talking to a guy that I ran into at this conference when I got here, and we were talking, and he's been in recovery, and he's been married to his wife a long time, and then they lived through the sex addiction and have been married 39 years, I think. And he said, yeah. So in recovery, I learned I can't lie. So he said, I've got honesty, and I can't sleep past 6:30 in the morning. And I started laughing because I thought, yeah, and both of those are true. It's like, I used to be I would call it a night owl, but I was just, partying, but like now I get up early and I start my day, typically, going out for a run or walk or whatever, but that's a good thing for me. But I cracked up with that. I was like, yeah, we do get honesty, and it is a path. It is a journey. It is, and we talk about it as an intimacy disorder, and I've talked to Dr. Rob about this too, because I said I don't think it's exclusive to just sex addiction or porn addiction, that it's an intimacy disorder. I think whatever form your addiction takes or forms, it's an intimacy disorder. You are not in healthy attachment. And I'll share this too, and I've shared this before too, but the ASAM, the American Society of Addiction Medicine, talks about, addiction, but, and gives a definition of addiction, and, without intervening on it, it's a chronic problem. But the guy that used to be the head of ASAM, at one point, I was in a meeting with him, and he said, there is no S in addiction. Addiction is addiction. And I was like, oh, that is brilliant, but that's how I feel too. It's like whatever form it takes, it still all comes back to the same thing. So we talk about seeking integrity, and we said seeking integrity because we own that that's the guideline that we always want to use, that we will always fall short. We're human, so we're not going to achieve that 100% all the time, but that's what we're striving for and moving towards. And that's what we want to guide, those that are, coming to the Seeking Integrity Los Angeles program towards, give them a foundation on which they can build, and continue on that journey. But it is achievable. I can, I know for sure. I'm living proof. David's proof. I know lots and lots of people that, have found, a way to live in integrity and with intimacy and connection to, to others. So it's a journey.
Sure.
I'm glad you're on the path. So
Great.
We are out of time. So thank you, as always, Dr. David. It was a pleasure to join you tonight.
Yeah, it was fun, Tammy. Thank you.
And I'll look forward to seeing you in St. Louis. Meet me in St. Louis.
Right. Okay.
Thank you to all of you that joined us. Scott will be back next week, Wednesday, with Dr. David. And Dr. David is subbed in for Dr. Rob occasion, so I hope you'll just join there. We've got so many great things going on the site. So if you haven't already registered on sexandrelationshiphealing.com, please do so. And you can set calendar reminders for the various drop-in groups and events. I am adding more. I've got someone who is going to do the old lady posse. We're doing, we've got more things coming, so I won't elaborate. Just keep coming back. So how's that?
Great.
All right. Thanks, everybody. Bye-bye.
Bye-bye, everybody.